In my talk, I will separate into two parts. For the first part, it's gonna be live demonstration at the neck here. And in the second part, I will summarize all the technique and the principle of the neck rejuvenation. So again, my name is Dr.Patchanon Asawaworarit, dermatologist from Thailand, or you can call me Dr. Pat or Dr. Kanom. So let's start for the live demonstration. As you may see here, I have already marking the lines of the treatment. So for the lines of the treatment, Dr. Manos has already told you that we have 3 lines in each side of the neck. Mostly we concern at the anterior part of the neck. So we have the area of the anterior part of the neck, which is located between anterior border of the sternocleidomastoid muscles here for 2 sides. And the lower border should be the clavicle or the sternum here. For the upper border is the submental skin axis here. So that's why we focus on the anterior part of the neck, because most of our patients will concern about the aging size of the skin at the neck here. So when we start, I will draw in the lines of the treatment, 3 lines in each side. So totally you got 6 lines of the treatment. Then I will inject the lidocaine and then inject the GOURI later. So shall we start right now? After marking the line of the treatment, give the patient in the relaxed way and try to hyperextension at the neck area. So you're gonna penetrate the needle and the cannula very well. So this is the lidocaine without adrenaline. I will inject for the entry point for 2 sides. The amount of the lidocaine usually used just very minimal. Just you can see the small view is enough. So they clean again for other sides. And then inject the lidocaine at the entry point here. GOURI is one of the easiest procedures that you can finish all the procedure in 15 minutes. So when we inject the lidocaine, we can start to open the opening for the cannula. I usually recommend you to use 25 gauge cannula, which you're gonna use the needle to opening the whole 23 gauge needle. So pinch the skin, needle in, circular movement. And here is the lidocaine. Normally, I use 2% lidocaine without adrenaline to inject along the lines here. Normally, we use only 0.3 to 0.5 mils in each line. You can use non-dominant hand, try to stretching the skin of the patients, gentle movement of the cannula until you reach the middle of the neckline. So when we reach at the middle line of the neck, we start to inject the lidocaine in the linear retrograde way. So where my cannula are staying right now is on the subdermal layer, superficial subcutaneous fat layer, or superficial of the platysma muscles. So the amount of the lidocaine should be about 0.3 to 0.5 mils. Then I change the direction to the upper part. So you don't need to be hurried. just gentle and try to cannulate your cannula in the upper way. Patients feel very relaxed. And then inject the lidocaine, linear retrograde technique. Small amount, just at least 0.3 mL. And then change the direction to the lower part of the neck at the same slide as we already marked. So that is for the lidocaine 1 mL. So I will start injection the lidocaine, the same technique on the opposite side.
Dr. Kanom, do you hear me?
Yes, of course.
What is very important to say for the neck is that we need delicate movements and to be in the specific layer. You can see here how gently she promotes her cannula on her neck.
Yes, that's right. Thank you very much. And you can see that I always stay in the subdermal area, which you can see the whole cannula here. So you can see the whole cannula along the muscle. And I try to inject very slowly of the lidocaine that make your patient feel more comfortable. And we don't need to use very much amount of the lidocaine.
I want to make a comment again that this is the most difficult part. After that, she will not feel anything. Don't try to inject GOURI without lidocaine because I told you before it's acidic, it's PCL, it creates a feeling of burn. That's why.
So you do it in the 3 lines. Each line I use just a 0.3 mL of the lidocaine. So it's not gonna cause any swelling after we done the procedures.
Also in the same session, you can combine Botox, okay, toxins in the same session for the platysma bands. In the same session, you don't have any problem.
Yeah, here is a GOURI. So you can see that GOURI comes with the pre-filled syringe. So it's ready to use after we unbox. We found the syringe and it comes with the GOURI. No mixings, no preparation. And then we can connect the pre-filled syringe of the GOURI with the cannula. So I use the 25 gauge cannula and I will inject GOURI in the same layer that I inject the lidocaine first. So right now it's going to be much more easier after you inject the lidocaine. So in each line, I will inject the GOURI about 0.3 mL in each line. So it's equal 0.99 or 1 mL syringe of GOURI. So I inject in the linear retrograde, please no bolus for GOURI because it can spreading very well.
We have to say that the GOURI spreads itself around 2.0 centimeters around the final injection point. So keep in mind this, okay? It's not staying only on the frontal part and goes and lateral.
With a small amount of GOURI and lidocaine, so after we done the procedure, so you will see that there is no swelling at the neck area. So we do the same in each line, 0.tt mils, and gentle linear lateral gate injection. So that's it for one syringe. So for the neck, I will use 2 syringes. We have 6 lines, each line 0.33 mils. So I use 1 syringe of GOURI in this side and 1 syringe of GOURI for other sides. So again, GOURI comes with a pre-filled syringe, so it's easy to use and ready to use and user-friendly for the doctors as well.
Now, if you are unlucky and you create a bruise in the entry point, please change the entry point or just leave the product about 1.5 centimeters from the entry point. Okay, she is very delicate, she is very experienced. Dr. Kanom will love you, you know that. And you see how beautiful she injected. The small erythema that she has, it's not something, after 15 minutes it will go away, okay?
Yeah. When I finish injecting in one line, I would like to change in other position or other lines. I normally don't remove my cannula out. So you can change the direction when you come nearly out of the entry point. And you can see that I use my non-dominant hand tied to stretching the skin of the patients and helping you create the tracking of the cannula. But remember that the gentle is very important for GOURI.
And I think that you use cannulas that they are rigid and not flexible. Am I right?
Yes.
In order to stay in the same layer. It's very important also this.
Okay, that's it. I think normally we don't need to use time for this procedure more than 15 minutes. I'm gonna clean up and I will show you immediate result that you can see. Most of my patients don't feel swelling or you don't need to massage after we did the procedures.
Can you ask your patient if she feels anything? What's the feeling that she has now after the treatment?
Feel anything else? He said that it's very good and he cannot feel anything else, even the needle.
It's very important. She doesn't feel any pain, she doesn't feel any itching. Don't be afraid. I know it's a new generation of injectables, but it's safe. Tell us.
So this is the result after we done with the GOURI at the neck zone. I used the 2 syringes of the GOURI and I used very small amount of the lidocaine, just only 2 mils of the lidocaine before I inject the GOURI in the same way, in the same layer and in the same tract. So I will summarize all the technique and principle of the GOURI later. See you soon.